If use of alcohol causes mental or health problems, it's alcoholism. There are more than 200 million people with alcoholism worldwide, and 4.1 of the population is over 15 years of age. Alcohol is a mitochondrial toxin or poison. Alcohol damages hemibiosynthetic pathways in the mitochondria. It means it affects directly blood cells formation. Alcohol is the most available, widely consumed, and widely abused recreational drug. Beer is the third most popular drink overall, after water and tea. Alcoholism may be characterized both withdrawal and tolerance. Withdrawal is the development of physical or psychological symptoms after the reduction or cessation of intake of an alcohol. Tolerance is the need for increased amounts of the substance to achieve the same positive psychological effect. Alcohol is a sedative central nervous system depressant. Uses of alcohol causes mild elevation of mood, decreased anxiety, somnolence, and behavioral disinhibition. Drinking enough to cause a blood alcohol concentration of 0.03 to 0.12% typically causes an overall improvement in mood and possible euphoria or a happy feeling, increased self-confidence and sociability, decreased anxiety, impaired judgment, and fine muscle coordination. Up to 0.25% causes lethargy, sedation, balance problems, and blurred vision. A blood alcohol concentration of 0.18% to 0.30% causes profound confusion, impaired speech or slurred speech, staggering, dizziness, and vomiting. A blood alcohol concentration from 0.25 to 0.40% causes stupor, unconsciousness, anterograde amnesia, vomiting, and death may occur due to inhalation of vomit or pulmonary aspiration while unconscious, and respiratory depression or potentially life-threatening. A blood alcohol concentration from 0.35% to 0.80% causes a coma or unconsciousness, life-threatening respiratory depression, and possibly fatal alcohol poisoning. Alcohol abuse is associated with traffic accidents, homicide, suicide, and rape are correlated with the concurrent use of alcohol. Child, physical and sexual abuse, domestic partner abuse, and elder abuse are also associated with alcohol use. Health effect on alcohol, the thiamine deficiency resulting in Wernicke's syndrome, and ultimately in Korsakoff syndrome. Liver dysfunction, gastrointestinal problems or ulcers, and reduced life expectancy are also seen in heavy users of alcohol. Fetal alcohol syndrome, including facial abnormalities, reduced height and weight, and intellectual disability, is seen in the upstream of women who drink during pregnancy. A childhood history of problems such as ADHD and conduct disorder sometimes correlates with alcoholism in the adult. Individuals who overuse alcohol commonly use in denial as a defense mechanism. The CAGE questions is used to identify alcoholic person. First, do you ever try to cut down on your drinking? Second, get angry when someone comments on your drinking. Third, feel guilty about your drinking. And fourth, take a drink as an eye-opener in the morning. The risk of alcohol dependence begins at low levels of drinking and increases directly with both the volume of alcohol consumed and a pattern of drinking larger amounts on an occasion. The Dietary Guidelines for Americans defines moderate use as no more than 2 alcoholic beverages a day for men and no more than 1 alcoholic beverage a day for women. The National Institute on Alcohol Abuse and Alcoholism defines binge drinking as the amount of alcohol leading to a blood alcohol content of 0.08, which, for most adults, would be reached by consuming 5 drinks per man or 4 per women over a 2-hour period. Occurs a blood alcohol concentration of 0.40% to 0.50% in non-alcoholics. Psychotic symptoms or a hallucination may be seen in alcohol intoxication as well as in withdrawal. Alcohol withdrawal, sometimes called delirium, also called delirium tremens. It may occur during the first week of withdrawal from alcohol. Third day is the most important. It usually occurs in patients who have been drinking heavily or years. Delirium tremens is life-threatening. The mortality rate is about 20%. A hangover is the experience of various unpleasant psychological and psychological effects following the consumption of alcohol. Typical symptoms of a hangover may include headache, drowsiness, concentration problems, dizziness, gastrointestinal distress or vomiting and diarrhea, depression, sweating, nausea, hyperexcitability, irritability, and anxiety. There are genetic variations that affect the risk for alcoholism. The alcohol dehydrogenase allele causes a more rapid metabolism of alcohol to acetaldehyde and reduces risk for alcoholism. For management, alcohol detoxification or detox for alcoholics is an abrupt stop of alcohol drinking coupled with the substitution of drugs, such as benzodiazepines, that have similar effects to prevent alcohol withdrawal. Heavy cases hospital are really needed. Various forms of group therapy or psychotherapy can be used to deal with underlying psychological issues that are related to alcohol addiction. Various forms of group therapy or psychotherapy can be used to deal with underlying psychological issues that are related to alcohol addiction, as well as provide relapse prevention skills. The mutual help group or counseling approach is one of the most common ways of helping alcoholics maintain sobriety. For medications, in the United States, there are 4 approved medications for alcoholism. Acompressate, 2 methods of using naltrexone and disulfiram. Acompressate can reduce or prevent alcohol withdrawal-related neurotoxicity. Naltrexone is a competitive antagonist for opioid receptors, effectively blocking the effects of endorphins and opioids. Naltrexone is used to decrease cravings for alcohol and encourage abstinence. Alcohol causes the body to release endorphins, which in turn release dopamine and activate the reward pathways. Disulfiram prevents the elimination of acetaldehyde, a chemical that the body produces when breaking down ethanol. Acetaldehyde itself is the cause of many hangover symptoms from alcohol use. The overall effect is discomfort when alcohol is ingested, an extremely fast-acting and long-lasting uncomfortable hangover.